We are back. I'm so excited to continue this conversation with you because we are talking all about now we're going to talk about midlife and fear. We started talking about fear and burnout and what stops us from living our authentic life. And now I want to talk about things that we have a lot of fear in their community about, which is all around aging, but more so hormones, hormone imbalance, menopause, all the things. So I want to start by asking this question first. Like, so one, tell us what you do now, but then I want to know what is one key piece of information that you feel like you wish Black women had about their health to kind of set the stage for this conversation?
Yeah, absolutely. So after I resigned for like, I literally was in my position for over a decade and I resigned, and it's been about a year and a half since I resigned. I've been doing a couple different things, but the thing that I'm most proud of is that I created a perimenopausal menopausal consultation concierge practice called Revival. And it's for patients who they're not feeling like they're being heard, listened to around their midlife journeys. And I specifically want to reach out to patients that I feel like are on the kind of the marginalized in the conversations around menopause. Menopause is hot right now, right? I feel like there's this like menopause renaissance,
Yes.
but when you look at who's leading the discussions, you seldom see people who are that look like me. You seldom see people who identify as LGBTQIA plus. You seldom see people who are maybe considered fat or disabled. And so it's kind of like the 50% of the population is going to go through this, yet the conversation is being dominated by a very few allowed voices. And so revival, meaning to live again from the Latin word revivere, is that like, how do we like use this midlife journey, talk about hormones, talk about like longevity, right? Talk about health, talk about all of these things to make sure that the second chapter of our lives is healthy and joyful and all of those things. So that's what I'm doing now. And I'm absolutely, look, I had a visit just before this and I'm like, whoo.
That is so great. It's so great too to be the face that is joyful. Like, I think so much of us have so much stigma around midlife that it is not considered a joyful time of life at all. So it is so good to see you present it that way and to be bought in like that. And I think that kind of probably ties into like, what do you think the key piece of information that you wish Black women had about their health would be?
So here's the secret. You ready?
Ready.
Take care of yourself first.
Yes.
I know,
Yes.
we say things like, oh, the airplane, put your mask on first, but we don't really subscribe to that, right? And there is an actual reason why when you go on the airplane and they're like, hey, put your mask on first before you can help others, is because literally, like, you can die if you don't do that. You will be good to no one if your mask is not on first. And so I hear moms, I hear, especially when you get in midlife, you're in that almost sandwich generation, like you might be raising children, you might be taking care of parents, and we do not put our mask on. And so we are giving to everyone, and there is nothing left over. And so there is nothing selfish about going to take a nap. There is no one will be hurt if you say, give me 30 minutes in my room, set a timer. This is what I do personally. And I'm like, hey, mommy needs quiet because I need to read my Before I Let Go book. Okay. Because I just got it from the library. Like you need to fill that vessel back up. I remember working with a therapist and she would say, children are not going to fill it for you. Parents are not going to fill it for you. Where are you filling your vessel? Right? Like you're getting pulled every which way. Water is splashing out. How are you filling that back up? Right? We run to go charge up our cell phones real quick when it falls below that 20%. What are we doing when we fall below 20%? So when it comes to health, and of course I'm saying, take care of yourself, but I'm saying get appropriate sleep, right? Cut out the things in your environment that cause stress, including social media, including news cycles, because not all news is good news, right? Cut those things out. Move your body. Movement is for everybody in everybody, whether that is a walk, whether that is just putting on a song and dancing and moving your body and really honoring the body that you're in. In my podcast, we talked to a sex therapist and she would say, you may not like what your body is doing right now, but you got to love on her. Right. And so,
Yes.
especially as we go through midlife and we're seeing our bodies change and we're like in the mirror, like we don't want to look and, oh, I don't like this about that kind of gets fed here. And so, I start small, like be thankful for the legs that carried you today because that's not a given for everybody. And then the stress mitigation. When we talk about hormonal imbalances, people who have high levels of stress, um, they have like cortisol overdrive, right? And cortisol is our stress hormone. It is amazing for survival, especially when we will run away from saber-toothed tigers. But guess what? It does not know the difference between that and regular stress. And so if you're in this overdrive, not only are you going to have poor sleep, you're going to have just your sympathetic nervous system. Now I'm getting real like techie with it, right? But like when we talk about blood pressure, when we talk about your heart, when we talk about all of these things, you gain weight, poor sleep. I mean, it's just so many different things. So when I say take care of yourself, all of those things fall under that.
And it accumulates. I think that's the other
Mm,
part to explain. Like the what people don't, stress has a cumulative effect.
mhm.
It people are when people say, for example, with panic attacks, what they've noticed is what people don't understand about panic attacks is it's much less about what happened 5 minutes ago and more what happened 30 days ago. That the
Yes.
stress accumulates and accumulates until you're having a
Mhm.
panic attack and it doesn't seem to make sense as to why I'm having this very large big reaction.
Right. To
And it's
something
the
that may
same.
seem very minuscule.
Exactly. And so it's the same thing when we're talking about health, is that there's a cumulative effect of good habits and a cumulative effect of bad ones. And everybody is going to go through the change of life, as they used to call it, right? Everyone is
Right.
going to have a hormonal change. Everyone is
Right.
going to hit a point in their lives where they are not producing the same level of hormones or not
Yes.
able to have children or have reproduce. That's going to happen, but
Mhm.
there are things that seem unrelated to that that have a direct impact on that
Mhm.
transition. And
Mhm.
that is why, like, the studies are showing that black women tend to have a more difficult
Mhm.
transition in hormones, and it lasts longer. It starts earlier and lasts longer.
And last
And
longer.
I believe that part of that, and I mean, you could speak to this more than me, I'm not a doctor, is that stress component, is that we've
Mhm.
already built up in our 20s self-denial and betrayal and working too hard and never taking care of ourselves.
Mhm.
And then we go into our 30s and we have other responsibilities, and it just keeps going.
Yeah, one of the big studies, Swan, looked at that, and you're right. Not only were our cycles, we experienced menopause sooner, our transition to menopause, which most people call perimenopause or that menopausal transition, which on average is about 4 years, tends to be much longer for us, sometimes topping out at 10 plus years. And while the median age of menopause is 51, we experience it 1 year earlier at age 50. And here's the thing, it may not seem very significant, but why that matters is that we know as those estrogen levels decline, that has direct correlation to three big systems, right? Menopause is not just your ovaries and your period stopping. It is a full body transition. And so we notice that we have increased risk of cardiovascular disease. Right? Just that 1 year, when you withdraw that estrogen, you get an increased risk of atherosclerotic development, which is directly correlated to heart disease. So you get an increased risk there. We see an increased risk of neurocognitive decline. And we see an increased risk of bone degeneration, like bone health risk because of osteoporosis, osteopenia, things like that, because of the withdrawal of estrogen. And I think what also needs to be said, especially when it comes to stress mitigation, is we live in a world like that is mired by systemic racism. And so there is a term called weathering that says because we are like having to deal and kind of shore ourselves up every day to go into a system that others us, right? That we are getting these kind of like the death by a million paper cuts. We are starting to see that change to how our sympathetic tone. So our we're hyper vigilant, we're hyper aroused, we have increased blood pressure, increased heart rates because we're also navigating these systems. So we live in this world, and we also need to be very active in counteracting those that impact in our own personal lives, which comes down to our own coping tools, our own stress mitigation tools, what comes down to sleeping, what comes down to eating well, what comes down to having pleasure in our life. Can I get a dopamine hit? Like that
Yeah.
is what I want all of us to really embrace and not mire in like, oh, well, if I do something that's for fun, I should be doing something that's productive. No, pleasure is a birthright.
That's
Pleasure is a
correct.
birthright.
Absolutely. Pleasure, joy, all of that, as you know, that is the mantra here. It is a birthright. It is a legacy. And you're absolutely right. The drive for achievement. We started talking about burnout and like the drive for
Mhm,
achievement. Part of that is in response to systemic racism.
mhm.
Part of that is into the narratives in our culture that tells you, oh, you're a black woman. That means you have to work twice as hard and you
Got
have
half
to
as much.
be the best, right? And that narrative of expending ourselves. And
Mhm.
it's, you will go your whole life and not have a regulated nervous system. You'll go your whole life
Right.
and never know peace, like actual peace, if you don't know how to interrupt that. And so I think that's really important that we center that. And the other piece too that I want to talk a little bit about is perimenopause, because while menopause is
Mhm.
having a resurgence, people do not talk about this until it's menopause. So,
Right.
I will use myself as an example. I had no idea. I'm discovering now that I'm, in my 40s, my early 40s, that I said, "Oh, I started having brain fog and I started having all these
Mhm.
issues." And the person was like, "Oh, yeah, you might not be perimenopausal, but you might be on your way to perimenopausal
Right.
and these kinds of things. How's your sleep?" "My sleep is terrible."
Right.
These are questions I never was asked by my primary care physician. And
Mhm.
and they were saying, I listened to an expert say that she was like, you should consider, if you need it, hormone therapy
Mhm.
at 35. At 35, you should be already talking about getting your hormones checked, and maybe you need something, or you can do it synthetic or natural, but
Mhm.
thinking about that at
Right.
35. And so, can we talk a little bit about
Yeah.
perimenopause, what people do not understand about it,
Mhm.
when they should start caring about it, and why
Mhm.
is it so important we talk about that phase of life?
Yeah. And again, that conversation is hushed hushed. Culturally, we have not talked about menopause even as a phenomenon that happens, even though half of the population will go through it at some point if you live long enough. And so perimenopause, even less so. And so, in terms of like kind of level setting with definitions, like I said earlier, median age of menopause, which is defined as, it is a clinical definition. It is defined as 12 months of no menstrual bleeding. That is what it's defined as. And so you go 12 months with no bleeding, you are now in menopause. So menopause is like a day, right? And then the next day you like postmenopause. And so, but that transition to getting there, like the ovaries, unless you're having surgery or the ovaries don't just say, okay, bye, y'all, we out. Like there is a gradual decline in that estrogen. And on average, it's about 4 years. And like I said, most people describe that as the perimenopausal transition or the menopausal transition, but it can be as long as 10 years. So if I say the bell curve is median age of 50, that means that there are some people that are on the earlier margin of that may be experiencing actual menopause 40, 41, 42, average like duration of perimenopause 4 years. So now we're talking about mid to late 30s when you're starting to have some of those symptoms. And so one of the first things that will happen is we'll see menstrual cycle disruptions. And sometimes it can be really subtle. It could be, oh, my periods were 28 days, now they're 25. Now they're 21. You start seeing the cycle getting closer together before you actually start seeing them space out. So that could be one of the first telltale signs. Vasomotor symptoms like menopause, estrogen deficiency or decline, however you want to define it, is a full body transition. So it's not just your ovaries are no longer producing estrogen and you stop getting periods. It is impacting receptors throughout the entire body, especially in the brain. And so as you're going through these like declines, you might actually notice some temperature regulation issues, right? So if you're having temperature regulation issues, what impact does that have to your day to day? You're at a big meeting. I have a lot of like, C-suite folks and they're like in a big meeting and then all of a sudden they break out and sweat. Their cute little blowout is not cute anymore because now it's all free, right? And they're freaking out. They're dipping out. They feel very self-conscious. There's lots of shame. And if they don't know what's happening, imagine how disarming and disembodying that can be. So we see that. And then if it's on the night side, now you have profound sleep disruption. And what do we talk about with sleep disruption? Increased cortisol levels, increased weight gain, fat retention, especially around the midsection, which actually has a huge impact to long-term health outcomes, especially insulin resistance and like we said, metabolic syndrome. And so when we think about perimenopause, and if you're starting to notice just subtle changes, like sometimes look, you know your body better than me. You've been living in your body for 30 something, 40 something years. Talk to your doctor about it. And this is what I want you to be really, really cognizant of. No two doctors are made the same. If you're not getting the response that you want, be really picky and go somewhere else to find somebody. I actually got certification in menopausal health because I realized that even in my own training as an OBGYN resident who can deliver a baby through someone's belly in less than 30 seconds, right? Who can do a hysterectomy and the patient walk off go home the same day. As that type of doctor, I didn't really learn a lot about menopause. We could talk another reason why that might be. I think it's because they tell the ladies go off to elephant's graveyard. We're no useful, not useful anymore because we can't reproduce. But like I didn't really learn a lot about menopausal health. And so I took it upon myself to try to learn as much as possible and then got certified by the Menopause Society in 2016. So this has really been my passion for the last 8 years. And I will say that there are people like me that you can like go to and have that conversation with because they're going to be a little bit more sensitized to it. So it doesn't surprise me that your primary care physician is not asking those questions. In fact, they don't want to know because menopause takes a lot of time and conversation, right? They don't want to really go down that rabbit hole of like, kind of getting you to feel better. Now, what I would say is I have some people and they say, you know what, I feel like I'm tolerating things. Yeah, I may have occasional here and there, and I think I'm fine. I don't want to try anything. Cool. I cannot fix what's not broken. So if you are feeling
Right.
well and your goals are just to kind of like stay the course, awesome. And the reason why I want to say that is because there are so many messages out in the world today about how to menopause.
Yes.
No two menopauses are the same, right? Your goals take precedence. So if your goal is to get your symptoms of hot flashes, night sweats, brain fog, let's explore that. Let's go through all of the options so that you know what you have. But if your goal is just like, hey, I'm feeling good and maybe I have some vaginal dryness, then let's explore that. Let's go this way. And I think that sometimes there's so much information out there that can be really overwhelming, but not a lot of understanding and bringing the knowledge together. And so I highly encourage people, as you feel your body changing and you know your body, listen, right? You know your body better than anybody else. As you're feeling that body change, then I really want you to kind of seek out the expertise of people like me who have that menopausal expertise to really help you navigate it and do it early. And can I say something else? Talk to a friend.
Yes.
We are all going through this, and it shocks me that people, they're like, "Oh, you're going through it too?" Yes, we talk about in our teens, everybody's talking about periods. When we're in our 20s, everybody's talking about sex. Ooh, we
Right.
talked about it a lot, right? Maybe in your 30s, maybe you're now having conversations about pregnancy, motherhood, if that is what you opted to do. So why is it when we get to our 40s, we have so much shame about talking about something that 50% of the population is going to go through? Talk about it.
Talk about it for sure. And I think the other piece underlying this is the way that we've been conditioned on the way to your 40s and your
Mhm.
50s is the other part of this is like there's so many hormonal imbalances in the black community and amongst black women, right?
Mhm.
Endometriosis, I have PCOS, all
Mhm.
of those things. What turned out to be me having a panic about being perimenopausal was actually getting someone to say, no, it's your dysregulated PCOS that is
Mhm.
causing these issues. They look similar, some of the symptoms, but I didn't even know
To
that was
ask.
something to
Mhm.
ask about. And so the other reason why I'm glad to have you on to have this conversation is because there are people who are listening. They're like, well, that's not me. You said 50. You said 40. I'm 32. Yes, but it starts with, is your menstrual cycle, are you tracking
Right,
it and is it
right.
normal? Because you won't know you're in menopause. It'll be a
Mhm.
nice surprise because you didn't pay attention all along and
Right,
assumed dysfunction was normal.
right,
And that's the
right.
part that's scary.
Yeah, and I will say society does not listen to women. And so we have been
Period.
conditioned in this way because when we were teenagers and missing school, right? Because we were having very painful periods, we were told, "Oh, it's just a period and it's normal." That's not normal. That's not
Right.
normal, right? Like there are things that we can do to help ease that so that you have a 13, 14, 15-year old who can go to gym class and go on the cheerleading squad or the basketball team. But we are like making up like these things like, oh, she just stays home from school and that's fine. That's not okay. And so, unfortunately, like with a diagnosis of endometriosis, it takes 9 years to diagnosis because nobody's listening to women and listening to women say, I'm in pain. And so, one of the things, like, I am a big advocate, if you feel like you're being shut out of the conversation with your doctor when you're bringing up pain and you know it, you feel it in your gut when you're like, they gaslighting me. I don't know, I feel like they're blowing me off, they're blowing me smoke. Like, go see someone else, go see someone else immediately. And I see this a lot in my perimenopausal menopausal patients, and here's why. This may be the doctor that delivered all your babies.
Yeah.
This may be the doctor that you've been with, who been with you when you were dating such and such, and he broke your heart, and now you had a pap test that was irregular, and you had to get on birth control. That's the doctor that you were seeing way back when. And now you're at this new transition. Your body's changing. And maybe that doctor just does not know how to care for you in this transition. You can still see them, but go to somebody who's a specialist who's going to help you navigate some of the other changes so that when you get to 50, we're already not starting behind when it comes to our bone health, our cardiovascular health, or our neurocognitive health.
I think that's really key. And I hope people hear this piece. It's like, be brave about advocating for yourself. It brings us full circle to where you started with burnout, right? The same way I want everyone to advocate for themselves, to opt out of struggle when it comes to their professional life and their personal life, also in your physical health. Do not be afraid. Do not let fear, do not let deep relationships with medical professionals, do not let that deprive you literally of your life potentially, but even beyond that, of joy, because it is not going to be fun if you ignore, don't treat, and find yourself at midlife with all of these health conditions you didn't know you would get, with all of this misery, and you sitting there, listening to this podcast at 30 being like, there's something you could do now, right? Don't wait till you're 40, 50 and beyond to start that journey. And if you have already, ask the folks. There's people listening to this podcast that are in their 60s and 70s. These folks have a wealth of information. Like, ask people. And we grew up being like, don't ask. No. Like you said, ask somebody. What was your experience like? What was this like? How did you cope? Should I be concerned? Listen to folks and advocate for yourself above all.
Yes, absolutely. And I have a lot of compassion for people navigating, I'm navigating it with my mom now, and I'm a whole physician, and it is very tricky. And so I have a lot of compassion for people who are trying to navigate and really advocate for themselves, because it can be very, very difficult in our system. And so you have spaces like, this podcast to be able to say, what are some resources? Like, you have interviewed amazing people. And so it's like, well, what are some resources that people can come to be able to find answers? At least point me into what is my next best step? There are platforms like Health in Her Hue, where like you can go on there, and there are people who are really like, I'm on that platform. Like, we take a pledge to say, hey, we want to take care of Black and brown women or people, right? And we want to take care of them and see them and see their humanity too. Unfortunately, I can say this as a physician, the healthcare space is sometimes not easy to navigate, and sometimes, especially as Black women, our humanity is not fully seen. But that doesn't mean that we don't have within our own communities ways for us to tap into incredible resources so that we can get the care that we deserve, frankly.
Absolutely. And that is again, you said pleasure, joy is our birthright. And that is the way we get that is by tapping into community as well. That is a huge birthright of ours as well. And there are resources.
Absolutely.
And so that's where I want us to go at the end. I always like to end with joy. And I want to talk about, when we come back, how we find joy in midlife. You used achieving a boundless midlife. I want to finally come to that and talk about how you just achieve joy in your life, period. So we'll be back with Dr. Miller as we talk about how to have a joyful midlife and how you find joy for yourself.